Good afternoon. We have talked previously about childhood trauma and healthy outcomes and chronic diseases. We've learned that the more traumatic events that you suffer relates to an increased risk of predictable chronic diseases like hypertension, diabetes, lung disease, cancer disease, heart disease, and depression, and other mental health issues. These traumatic events are multifaceted and includes things like repeated stress of abuse, neglect, substance abuse, and alcoholism, as well as many other things that we could add to the list. We know that the more traumatic events that are faced, the higher our risk of developing certain illnesses. So as we think of healing and prevention, we need to start early and deal with the trauma of early childhood. We also need to consider this trauma when we are diagnosed with these illnesses as adults. Hypertension, diabetes, and obesity are common illnesses seen in the African American community, whether through heredity, traumatic events of childhood, or the everyday stresses of daily living. We must face the underlying causes contributing to these illnesses in order to think of healing. We must dig deep and consider all aspects of care, including our access to health care, the affordability of insurance and health care. And we also must include empowering our patients and people to do their part in taking care of their health care needs and well-being. There are things that we have control of and some things that are beyond our control, individually and collectively. We must all do our part. Individually, we must do all the things that we're taught: diet, exercise, compliance with medications and medical care, including meditation. We must work on decreasing the everyday stressors, and we must take care of our mental health as well. When we look at everything that's going on today, I think we've talked about two good examples with the COVID virus and with maternal mortality and infant mortality. All of those things that we've talked about today puts us at an increased risk and vulnerability to COVID-19. In addition to chronic illnesses and increased stress, the added impact of social distancing in a culture where multiple families may share a home or live right next door to each other. We may be caregivers of other family members. We may be dealing with the added stress of being out of work or being in the workforce as an essential worker. So given all these things that we have going against us, we must maximize all the things that are going for us. We need to do all of this in our part that we can prevent the virus by decreasing our vulnerability. Wear a mask or face covering that covers the mouth and nose. Social distance as recommended the best that we can. Wash our hands frequently and thoroughly. Frequently clean surfaces around our homes and offices. Isolate and quarantine after exposure, not just some of the time, but all of the time. I have patients come in and, just by the way, I was exposed to COVID and I'm supposed to be on quarantine. I'm like, well, why are you sitting here in my office if you're supposed to be on quarantine? We try and do things. I've tried to put in place things to help decrease the likelihood of passing the disease on to myself, my patients, my staff members, but educating and keeping the public aware of the things that they need to do. We, have to consider going back to empowering everybody to do their part to make sure that our vulnerability is decreased to these illnesses. And, when you look at maternal mortality, just like the young guy in the video, that's a real big problem for our community. We know that Black women have increased problems with maternal illness and maternal mortality than other populations. We need to put in place things to combat these issues and do our part to improve these things. We've had a lot of things and recommendations put in place for improving hypertension and obesity and diabetes. You know, we have a lot of things going against us when we try and do those things. You know, oftentimes we're not diagnosed as early as we should be. We haven't been able to seek the medical care that we need to. We try and get insurance, but can't get insurance. You know, even with the Affordable Care Act and making access to health insurance available to many, the powers that be and politics and the daily struggles have prevented that from happening in a lot of cases. We have the southern states and other states as well that don't participate in the Medicaid program in terms of enhancing Medicaid availability to people that fall through the loopholes. So there are a lot of things going on that we just, you know, have little control of. So collectively, we need to do our part to kind of work on that, improve the health disparities in our communities. We unfairly have a higher burdens of illness, injury, disability, and mortality based on our lack of health equity. Disparities like health insurance coverage, access to and use of the healthcare system, and the quality of the healthcare that we receive. Even things like geography, time constraints, language barriers, all have added impacts. When you consider changes being made today to improve these disparities, we fall short because of the politics of the time and all of our long-term struggles. We still fall short. So we've got to step up and be creative and do some things to help improve this situation. So all of this to say, you know, we've got to do our part, try and stay as healthy as you can, decrease your life stressors, seek health and open discussion about what's going on in your life, stresses that you may be facing. Don't be afraid of seeking health care. You know, don't feel proud of the fact, well, I've got health insurance, but I've never used it. You know, it doesn't make sense in today's world. You know, if you've got access to health care, definitely use it. Definitely utilize your insurance if you've got it. If you don't, you know, seek help and advice any way that you can. And, you know, either, you know, now they've got telemedicine, which sometimes it can be more affordable. Sometimes it can't, but it's not the answer to everything but it does offer some solutions, particularly in this in these pandemic times. So all of this to say is, you know, everybody try and do your part, get out and vote, encourage others to vote, have open conversations and discussions about the needs of our communities, and just try and do your part in maintaining your health and the health of those around you. And I think that kind of concludes what I really wanted to say. I said a little bit about a lot of things and not a lot about anything, but hopefully you've been able to get something out of my talk. Thank you.